Welcome to Should I Get the Shot? A community conversation and open discussion about COVID-19 vaccines hosted by the University of Maryland, Baltimore Intercultural Center. This virtual event is intended to provide a safe space to ask your questions and share your thoughts and concerns about COVID-19 vaccines. Now, almost no one alive has had to live through what we have this past year, a pandemic. So there's plenty of reason for people to be nervous and concerned about really everything having to do with COVID-19. Even the long-awaited medicines designed to bring an end to the pandemic, the vaccines. Now, the questions people have are not trivial, and these days, with so many often conflicting sources of information, it can be hard to know who to listen to. Should I get the shot if I'm pregnant, if I have a chronic condition, if I've already been infected by COVID? How do I know if these vaccines developed so quickly are really safe? How can anyone know that? Are there ingredients in the vaccines that might be harmful now or in the long run, or might violate my religious convictions? And why should I trust a medical establishment that has historically sometimes shown very little concern for people of color or people who live in disadvantaged communities? Now, that last question is a very, very big one, especially in a city like Baltimore. Now, just look at the numbers. According to the Centers for Disease Control and Prevention, right here in Maryland, where 30% of the population is Black, only 17% of vaccines have gone into the arms of Black residents. And it's even worse for Maryland Latinos. They make up 11% of the population, but have received only 4% of the vaccines. And this after months of reports of higher infection and death rates for Black and Latino Americans all across the country. Of course, there are a lot of factors at work here. Black and Latino Americans are less likely than white Americans to have reliable internet access to make appointments or to work the system to sign up for a vaccine. Are less likely to have flexible work schedules to make appointments and even dependable transportation to get there. And they often lack access to good information and trusted healthcare providers who can help them get through their concerns about getting the shot. So that is what we're going to try to do here today with some of the best people we know to help answer your questions. Our host today is Courtney Jones-Carney. She's Executive Director of Intercultural Leadership and Engagement and Director of the UMB Intercultural Center. She's joined today by two members of the University of Maryland School of Medicine faculty. Dr. Mario Majette is with the Department of Family and Community Medicine, and he's Director of Student and Employee Health at UMB. And Dr. Milagritos Tapia is here from the Department of Pediatrics. She's also an infectious disease specialist in the Center for Vaccine Development and Global Health. And we have other experts in the audience we can call on to help out if the need arises. So we'll see how that goes. But before we go any further, I need to tell you this program is being recorded and will be posted on the UMB homepage, umaryland.edu. And although a number of questions have already been submitted in writing, your questions and concerns are very important. That's why we're here. So write your questions or anything you want to share in the chat area. Select chat with host, and when the time comes, we'll call on you. I'll unmute you. You don't have to do anything. And if you prefer to remain anonymous, just let me know that and I'll read your question for you. Now let me introduce the president of this fine university, Dr. Bruce Gerald.
Thank you, Alex, and it's a pleasure to be here. I'd like to give greetings to all of you in the audience. Thank you very much for joining UMB for this very important community conversation. I'd also like to give a shout out to Courtney Jones-Carney, the Executive Director of our Intercultural Center, for the effort that she's put in to making this event useful to you, those of you in the audience. Some of you may know that for over 40 years, UMB has been the home for the Center for Vaccine Development here at the School of Medicine. This vaccine development program has been internationally known for its ability to develop, test, and deploy vaccines, as well as deep expertise in infectious diseases. With COVID, UMB and the Center for Vaccine Development was home to one of the first vaccine trials conducted. They led trials for the mRNA vaccine model developed by Pfizer and also by Moderna. You've heard of these before. Over the decades in the past, CVD has been known for its trials in vaccines. And in fact, I've been here for over 20 years, and I felt it was important for me, myself, to be in these clinical trials. And I have been in 4 prior vaccine trials at the CVD. I think it was important to state that if it's safe for me, other people ought to be confident in that. And I also wanted to make sure that I was impressed with the quality of the program and the rigor with which the Center for Vaccine Development went about its clinical trial. I have to tell you, I participated in the Moderna clinical trial this past year. I saw high rigor in the Center for Vaccine Development. They had their data right, they had their process right, they paid close attention to me, and I did very well with that vaccine. So I know firsthand that the vaccine has been well vetted by individuals. Now, having said that, I understand that those of you in the audience may have concerns or questions about these vaccines. And I also acknowledge what Alex said earlier of the historical and current impacts of medical racism. So this discussion is put together for you, for your questions. You have a panel of experts before you. I hope that you will feel comfortable in asking whatever questions you may have about COVID-19 vaccines today. We are here to give answers to you and hopefully satisfy some of your questions about these vaccines. So with that introduction, I'm going to turn it over to Courtney. Courtney, the court is yours.
Thank you so much. Thank you, everyone, for being here today, and thank you for your potential vulnerability in this space. Thank you, Alex, for that thought-provoking introduction, and Dr. Gerald, we thank you for the introduction and prioritizing this important community conversation. We also like to note that Dr. Gerald will be leaving us shortly just to ensure that people feel that this is a space where they can indeed be vulnerable. Not that Dr. Gerald would judge, but sometimes having the president of the institution in the space could make some people feel a little hesitant. Thank you, Dr. Gerald. As we engage in institutional, local, regional, and national conversations about COVID-19, it may not be clear to all of us how to proceed. As a health and human services university, there may seem to be a collective belief that getting the vaccine is an obvious choice. After all, infectious disease experts agree that the best way to protect yourself, your family, and your community is with a vaccine, continued physical distancing, COVID-19 testing, and contact tracing. Yet a simple statement like this, while it may be a scientific reality for some, it does not acknowledge the complexities of the role of systematic medical mistrust on decision-making. I recently authored an op-ed which was inspired by many of the conversations that I had that showed a lack of understanding for the historical and current ways that experimentation and patient healthcare provider interactions contribute and perpetuate systematic medical mistrust. This op-ed, published in the Elm and Diverse Issues in Higher Education, explored examples of medical experimentations that preyed on vulnerable populations, specifically people of color, those of lower socioeconomic status, and those lacking freedom, whether enslaved or imprisoned. This isn't simply a conversation about the U.S. Public Health Service study of untreated syphilis in the Negro male in Macon County, Alabama, also referenced as the Tuskegee Syphilis Study. This is a discussion of the cumulative effects and historical legacy of medical harm and its impact on current practices. It is about instances in health professional education that teach stereotypes while minimizing what is expressed by patients. This is in reference to a section on pain in the text Nursing, a concept-based approach to learning that advises nurses to evaluate patients' pain based on their racial, ethnic, and religious backgrounds. This discussion is a result of false narratives that contribute to 50% of medical trainees surveyed in the 2016 proceedings of the National Academies of Science study, indicating one of the following is true about Black people. Their nerve endings are less sensitive than white people's nerve endings. Their skin is thicker than white people's skin, and their blood coagulates more quickly than white people's blood. This is also about emerging stories of the inability for many people, especially people of color, who want to receive vaccination but cannot access it. This is a discussion on how the lived experiences of many can contribute to medical mistrust, vaccine hesitancy, and more questions than answers. There is no And then in our 90 minutes together, we can reverse a system of mistrust or answer all of your questions, which are valid and steeped in your experiences. However, in creating this event, we aim to field questions that explore what contributes to your mistrust while exploring your right to ask questions and seek more information on the vaccine. We also encourage attendees to share their testimonies and experiences with medical harm if you feel comfortable doing so. We will approach this conversation from a space of recognizing that the experiences of the individuals who have decided to be in this space today, I want to make sure that we have mutual respect for our panelists and our participants. Our goal does not need to be agreement. Instead, I challenge everyone to be brave, vulnerable, and introspective. And I encourage our participants to ask their questions about getting the shot without fear of judgment. While I know some of you may have questions and may have already submitted some of those to Alex, in the intent to that are connected to the intent to increase UMB's on-campus density starting on June 1st, please note that our panelists are not positioned to answer those sorts of questions. Please keep that in mind when you're forming your questions. So let's get started. As mentioned earlier, we are joined by Dr. Mario Maget, clinical instructor in the Department of Family and Community Medicine and Director of Student and Employee Health, and Dr. Milagritos Tapia, professor in the Department of Pediatrics and an infectious disease specialist in the University of Maryland School of Medicine Center for Vaccine Development and Global Health. In anticipation for this program, we collected many questions in advance, and I'll start us off with 2 or 3 of those questions prior to shifting to your live questions and comments. So the first question for our panelists: do you think we have enough information about COVID-19 to make an effective vaccine?
Yes, I would say that we do have enough information. We learned early on in the pandemic, we were as relates to the development of mRNA-based vaccines, we became aware of the genetic sequence of the virus, and we were able to use that information quickly to adapt previously developed mRNA vaccines and make them specific for the new virus, SARS-CoV-2. And with that information in hand and the previous experience that we'd had as scientists, the scientific community had with developing this new platform for vaccines, we were able to quickly pivot previous technology and develop again a vaccine that was specific for SARS-CoV-2. Similar efforts were used to make the other vaccines that are currently being developed, the viral vector vaccines as well, counted on technology that had been previously developed for vaccines against diseases such as Ebola.
Hey, Courtney, I'm going to use this to kind of also jump in with one of the questions that I've had to answer several times, both individually and also kind of collectively in larger groups that I've kind of talked to before. And one is, it's very similar to this, but one is, hey, this vaccine, it was quick. Can we really trust it? Did you guys skip some steps? Is this something that's safe? So the way I try to tell people, at least to explain, I like people at least kind of conceptualize it, is that I use my kind of building a house model. So if you're building a house, you clear the land, you put down the foundation, and then you kind of start doing the framing of the house. But the next couple steps are things like all of your what do they call them? The folks that come in, the plumber, the electrician, the HVAC people. If we did all of that and the plumber came in and did everything they had to do, and that took, let's say, 6 weeks. Then the electrician came in and did what he or she needs to do, that took 6 weeks. And then the HVAC people came in and did what they need to do. That took 6 weeks. That thing's done in series actually makes that process very long. And that's typically how vaccines are typically come about, is that we start with the research, then they move to phase 1, phase 2, phase 3, and then they do the development, and then they do distribution. What really happened with this COVID vaccine is we didn't skip any steps. We just kind of did steps in parallel. So the U.S. government kind of backed all of these vaccine makers and saying, hey, if you go ahead and start making this vaccine, now, even before you have all of the research done, all the phases done, we will back you so that you will not lose any revenue in the process. We kind of got you covered there. So when they took all those steps and they did them in parallel, that took that process, which typically takes months and even years, down to just a few months. All the steps were done, but they were done in parallel, which really accelerated the benefit of the vaccine coming and getting here in this past, 6 to 8 months that it took to actually get the vaccines, at least the first vaccines, from study to actual in the arms. So hopefully that helps people understand that this is not a process that we did that we were unsafe in, or we skipped any steps. We just did steps simultaneously, which saved us a lot of time.
Dr. Majid, I really like that analogy because like you said, the US government, what they did was put in the money and said, you can call the plumber, you can call the electrician at the same time because I'm going to give you the money to do that. Instead of companies having to call one first and then say, oh, did that work? Now let's get money to call the plumber. Now let's get money to call. So everybody, all of those limitations, financial ones, were eliminated as obstacles.
Thank you for that. I think that provides some really good framing for folks around the timeline. We also had a question about lifestyle and vaccinations and vaccines. So is the vaccine necessary if you live a holistic lifestyle, if you have a strong immune system, if you are, exercising regularly? Can you speak to that at all?
Yeah, short answer is yes. Your immune system, that concept of having a strong immune system and living a healthy life and that protecting you from infectious diseases is really something that should be debunked. All that stuff is important, so I'm not trying to minimize that or discredit any of that stuff that's important for your generalized health. But this virus and viruses, you can't fight off your viruses like this with the healthy living. It just doesn't work.
I think the other thing to point out too is that this was a completely novel virus. The world had not seen it. No human being on earth had seen a virus that looked like this. And so there is no, as Dr. Majid pointed out, that healthy living that would have prepared your immune system as compared to anybody else's immune system for this virus. So that's why we need the help of vaccines.
All right, thank you for that. I think shortly we will, after this final question that came in advance, we can shift to live questions from audience members. But there are a lot of questions that came in about side effects. And so side effects for dose 1 versus dose 2. Can you talk a little bit about those side effects and how those might differ if you're receiving a vaccine that has 2 doses?
So what we've seen with the Moderna and with the Pfizer vaccines against the mRNA-based vaccines, we've seen that participants or patients, can develop fever, some general fatigue, some difficulty with sometimes you can get a rash at the area of the injection, you can get pain at the area of injection, and you can have some just generally not feeling well, and chills, things like that. And that can happen after the first dose. And if it doesn't happen, that's fine too. Doesn't mean that the vaccine didn't work. And then after the second dose with those two vaccine products, we've seen that sometimes people who had effects after the first dose have more pronounced effects after the second dose, or after the second injection. And so that is something that we have observed. We observed it during the trials of these vaccines, and it has been observed anecdotally also, among the millions of people who receive the vaccines now in the United States. For the J&J vaccine, there too, you can have some headache, some fatigue, and some generally not feeling well, and that's a single dose vaccine, and that can occur after the first dose as well. After that one dose, excuse me.
With that, our audience should please understand that these are mild side effects that last usually from 24 to 48 hours. So the benefit you're getting, or the downside of actually getting vaccinating, having a sore arm or feeling a little achy for a day or two, doesn't compare to the benefit you're getting from being protected from COVID and actually having COVID and potentially being in the hospital, or obviously even worse, dying from COVID. So it's a It's a small annoyance to put up with to get the benefit that we're talking about.
Thank you. Alex, do we have anyone queued up to ask a question?
We do. Let me just get to, I want to get to Opsene. Now, you know what? I'm sorry that I'm a little discombobulated. You came to me quickly. Anyway, I want to go to Opsene Najapsade.
Mm.
Did I pronounce your name right? I'm going to guess no.
Hi. Yes, my name is Afsan and not Afzadeh. It's a Persian
Okay,
name.
it is. Go
So
ahead,
I
please, with the question.
quite understand that it is difficult to pronounce. I work with Catholic Relief Services here in Baltimore. My question was regarding the side effects and side effects of the vaccines. I got my answer partially, but then I have heard some severe side effects to some of the vaccines, maybe even death at some cases. I am not sure if it is a rumor that's going around or there is some reality to it. I have heard some people who have taken the vaccine have died. So that's why I'm concerned about the side effects. I would appreciate it if you could address my concern.
Certainly. There have been no deaths that have been found to be related to the vaccine. There are events that have occurred that have been related in time, but there hasn't been any evidence at this point that any deaths that may have occurred that were temporally or just happened to coincidentally occur at the same time were actually related to the vaccine. To use an extreme example, if you went to the vaccine clinic and walked out to take the bus or something, and you walked the street and you were, struck by an automobile, that may have occurred after the vaccine, but that doesn't mean that it was related. And that's obviously certainly not related, and it's not that someone would suspect that. But there are other more subtle events that can occur that people may cause them to wonder, but that doesn't mean that they're related.
And I want to add to that, when they kind of look at deaths after the vaccine, they give a time limit. They say, has this occurred within 24 hours or within 3 days or 7 days after the vaccine? And we have to come up with some definition that says, hey, this could at least potentially be vaccine related. So once we kind of they ran those numbers, I kind of just looked this up quickly last night, and this was as of sometime in mid-February. There were about 1,100 or so deaths that were temporarily related to the time after getting the vaccine. But when they looked at, that's across the world, and that's across millions of doses of vaccines being given. But when they looked at the actual, like Dr. Miligranos was saying, looked at the actual cause of those, they really couldn't associate the vaccine with the cause of the death. And when they also looked at the number of people that would have died in those age groups, regardless of getting the vaccine, it was the same. So the vaccine did not show that these deaths were any higher percentage of the deaths that would have occurred just naturally, because obviously people die from all kinds of causes on a regular basis. If we just compare that to I think there's like 2.6 million deaths across the world that have been caused by COVID vaccine that we know of, and that's probably even underreported, just because how some people kind of send in the data from different countries. 2.6 million versus 1,100 that may have been related to COVID. It's just, there's no comparison there. The numbers are just astronomically different. So if you're a betting person and you want to take your chances, I would definitely take my chances with the vaccine every day of the week, twice on Sundays, as they sometimes say.
Thank you for those answers and for that clarification. Alex?
All right. We often talk about the concerns about pregnant women who were not part of the studies for vaccines. But we had this question about a new mother. She writes, should lactating mothers get the Johnson & Johnson or the Oxford vaccines without any concern for breastfed kids?
Yeah, I'm gonna say that's a tough one. In that when we give, obviously we're giving our answers to you guys. We want to give answers that are based upon some data and some research, and we just don't have a lot of good research to back up an answer. But I think the second thing we do when we in medicine when we don't have data or research to back things up is we kind of think about consensus. The specialists get together and they kind of give their best kind of assessment of what would how we can answer this question. And the consensus is, in general, there's been no relation between the vaccine and nursing mothers. Also, there's been very little evidence that shows the vaccine has an effect on pregnancies. Now, of course, I want to use the caveat again that we didn't study the vaccine in pregnant women, nor did we study them in breastfeeding mothers. So we can't really back that up with any strong data. And when we do get some data down the road, whether it's 6 months from now or a year from now, that answer could change. But that's probably the best answer that I can give right now is that we have no data to show that it has any adverse effects to mother or baby.
I would add too that from what we understand and what we know about the technology used to develop these vaccines and how they work, we also have to consider the biological plausibility. So how likely is it, based on the way that we know that these vaccines work, that there would be any type of transmission to a fetus or any type of effect rather on a baby that was being breastfed? And just based on that science, again, I would say that it's extremely unlikely that there would be any effect because, again, of the way that the vaccines are made and how they work. So the Johnson & Johnson vaccine specifically, since that was the one that was mentioned in the question, is one that was developed to be used in it's a virally vectored vaccine. So there is a virus that was developed and it expresses one of the proteins or makes one of the proteins of the coronavirus. And that viral vector does not replicate in the body. So if there was any concern about the virus actually causing a problem for the person who receives the vaccine, it's not possible based on the fact that that virus does not multiply inside the human body. And so again, the likelihood based on that alone that there would be an effect makes it extremely unlikely.
So although that question was specific to breastfeeding, we did give some information about those who are pregnant, but I know that we had some questions about those who are thinking about conceiving in the future. Would you like to share some information on safety for those populations?
Yeah, the vaccine from the same standpoints appears to be very safe even in pregnant women. There's been no evidence to date, although they are starting to look at some of the women that have decided to get vaccinated and are either pregnant or trying to get pregnant. So we'll have more information with that in the coming months. Yeah, there's just physiologically and from a scientific standpoint, it doesn't make sense when you kind of think about the science that this vaccine should cause any problems with conception or, of course, the development of the baby. But we also haven't done studies again. I want to just point that out. And one other piece I want to also just point out is we're giving this kind of talk from a large perspective. Folks that have individual questions, don't hesitate to contact your own private physician to talk these questions over, because we're giving broad answers, and the individual might have something that's specific to them that requires their doctor to take something else into consideration. So I don't want to make sure that people aren't taking what we're saying here and using it to override anything their personal physician would suggest for them.
All right. Alex, are there other questions that are coming through?
We have so many questions you wouldn't believe. You have a very fired up audience, and several of them are focusing on a different data point. We've talked a lot, about the level of immunity that these different vaccines may offer, but we have a lot of questions here about the durability of that immunity. Is it going to last a long time? Do we know anything about the three different vaccines that have EUA? And a little different twist. One person writes, how does this compare to the immunity established for those who have been infected, rather than gotten the vaccine? And if I've been vaccinated, can I still infect others? So there's a lot of questions about the durability of immunity.
So these studies are still ongoing. The same studies that have shown that the different vaccines prevent infection, hospitalization, or death from COVID-19 are still ongoing. And the reason that that's important is one of them is specifically to answer this question of how long will people be protected? We are still learning about that. What we know so far is, for example, the participants who participated in the very early studies of these vaccines, the data suggests that the vaccine, it continues to protect these persons this far out, so up to almost a year out for some of those participants or some of those studies. So that is very promising, of course, that the protection afforded by these vaccines seems to go at least that long, but this is something that we're still learning.
I would also add to that, where the common thought right now is that 90 days is probably all that we can kind of really hang our hats on as far as protection. And so if it's the Pfizer vaccine or the Moderna vaccine, we consider you fully protected 2 weeks after you've had your second vaccine. The Johnson & Johnson vaccine, currently we're saying 2 weeks after you've received your Johnson & Johnson vaccine, that you are fully protected. And as far as the folks, CDC and other kind of researchers are willing to go right now to say how long the protection lasts is 90 days. As we get more time with these vaccines, we'll hopefully be able to expand that to actually say, hey, maybe it is 90 days, maybe it's 180 days, maybe it's a year. But that answer is still we just don't have an answer to that just yet. The other point I'd like to make is that there's been a lot of question about, what do you do? Well, I've had the vaccine. Can I start to stop doing all these other things that have been stopping me from enjoying the life the way I want to enjoy them? The short answer to that is no. We would like everyone to continue to do all of their kind of precautions that they've been doing for COVID previous to this to reduce transmission, which means you still need to social or physical distance. You still need to wear your mask. You still need to wash your hands regularly and disinfect your common surfaces. We still need to continue these practices in order to continue to decrease transmission. This is the layered approach that we're trying to use to keep people safe. So vaccination is just one of those layers. It's a very effective layer, but it doesn't cover you from everything. So if you add the vaccine plus your mask you're wearing, plus you're staying distance from large crowds and large groups, and you're washing hands and you're disinfecting surfaces, that is your best way to keep yourself, not just yourself, but your family and your loved ones from also getting sick.
I have to just say something here, because I know we have a very well-informed audience, and I know I'm going to get questions about what you just said. In light of the CDC information the other day saying, a couple of people are vaccinated, it's okay for them to be maskless together. How do you reconcile that?
Yeah, so and it is a really good point, because obviously that just came out, I think, Monday, when they came out with that new recommendation. So just 2 days ago. And just so everyone's kind of clear, they are saying that, hey, if you've been fully vaccinated, again, 2 weeks since your second vaccine or first vaccine for Johnson & Johnson, when it's available, that you are considered protected. And they do specifically say small groups. So they're not saying that you can just go out and go to a concert, gather with, at the bar on spring break with friends. They're saying, a small group of folks that have also either been already vaccinated also, or just a small pod in a single kind of family. So there's a lot of caveats to that. And I think the overall picture that I try to tell people is that we want to make sure that we're doing this in a way that's still a low transmission risk environment. And if you look at things that we're talking about, us being with your family, being with your other folks that are vaccinated, that's the low risk we're talking about. It does not say that you can go to a restaurant indoors that has 100 people in it. It does not say anything about bars. They are not endorsing travel. They are not endorsing a lot of these other activities that we really want to get to. Now, I think hopefully down the road, we will be able to endorse that. But still, right now, there's way too much COVID still going around, and there's too many questions that are unanswered, particularly with our variants, which are sometimes popping their head and causing us a little bit more concern, and will cause us more concern going forward, that we just don't have information for.
So everyone is not able to physically distance in their home, right? They may have multiple individuals living in their home, multiple generations, people with varying risk factors. And so what sort of advice do you give to individuals who have received the vaccine, but live in a household with individuals who maybe have not received the vaccine?
I think the first thing I tell people is have serious adult conversations with your people in your household. That's where it starts. If you have, let me just give a kind of small scenario. If you have a young person, let's say in their early 20s, that and I'm gonna kind of make a couple assumptions here, that may be hanging out more or doing more activities outside the household than some of the older populations. You're going to have to be able to trust that person, because they may be safe in the house, but if they're not safe outside the house, when they're with their friends, when they're in school, when they're on their job site, they are very potentially bringing that virus right back into the household and making everything unsafe. So having those serious conversations, and again, I say adult conversations because they're not always easy, and that person may have to wear their mask when they're in the house. Or you might have to decide, hey, if you're going to continue to participate in those activities outside of the house, then maybe this isn't the best household for you to be in. So these aren't easy conversations to have, but if you're really trying to protect yourself, I think they're the ones you have to have, and you have to be honest with yourself and with your family members and loved ones about what you're trying to do. It's not easy. So again, I know I'm kind of saying this, obviously, sitting here on this Zoom call saying this, and I've had conversations with family members of my own. So I do understand that they're not easy conversations, but they are the ones that we need to have, because there's what's going to keep us safe.
All right, let's go ahead and take another question from our audience.
All right. So you had great explanations earlier about how scientists were able to develop a vaccine faster, but I don't think all the answers about that it hasn't really settled in with people. I want to bring in Cindy Rice, and Cindy Rice, and she has a question about that analogy that you. Cindy, are you there?
Yes. Hi, Alex. I'm here. Can you hear?
Go. Yes, go ahead.
Okay. Good afternoon, everybody. Courtney, how you doing? Shout out to you, Dr. Majette and Tapia. Thank you for taking my question. My question is, if, going back to the plumbers example, would there be any type of steps or effectiveness of the vaccine lost in while the vaccine is being made, if you are skipping some of the steps, so to speak, or if you're doing the steps in parallel versus in series, which takes a little bit longer? I'm just wondering about the effectiveness of the vaccine itself, because I got my first shot yesterday. Thank you.
So with that, no, because they actually didn't skip any steps. all the steps were taken, and I kind of, it's using that same analogy. At some point, you have the people from the housing department or from the county that come and do an inspection. Before they close up the walls, they have to come in, they have to say, hey, the electrician put this stuff in properly. He didn't violate any codes when he wired your house or hooked up your whatever you have hooked up in your house. So they do those inspections. FDA is the same thing as our home inspector or the people that have to come in. So the FDA checked off on each company's steps along the way. So they couldn't really, although they were doing things in parallel, the same checks and balances were always there. And so everything that was done is the same way it would have been done in series. It was just that it was done in parallel. Does that answer your question?
I think it did. I think it answered her question. You know, one of the just because of timing purposes, we talked less about the Johnson & Johnson vaccine. I want to bring in Sandra Quezada, who has a question about that and wants to get some good information that might alleviate some concerns about it. Go ahead, Sandra.
Oh, thank you. First of all, thank you to the panel for this amazing presentation. I've really enjoyed it. And you reminded me of a question that one of my colleagues recently asked. You know, we're taking care of patients who are on immunosuppression and have been reassuring them about both the Pfizer and Moderna vaccines. And, you know, there's new vaccines coming, available now, the Johnson & Johnson, and I imagine some others coming down the pike soon. And so there was a question in our group about whether there was any reason why the Johnson & Johnson vaccine might not be as effective, not necessarily as much concern from it. Well, actually, there were some questions about its safety as well. And my understanding is that none of these vaccines are live vaccines. And so they should be safe. All of them, you know, not just Moderna and Pfizer, but all of them should be safe for immunocompromised patients. But I wanted to see if you could confirm that for us. Thank you.
Yes, so they were not, to my knowledge, specifically studied in immune compromised patients who have are on immunosuppressants to the degree that it would have compromised the evaluation of the vaccine. So, and I realize you probably understood what I said, but maybe not everybody. So when we're studying vaccines, you know, in clinical trials, we are trying to study it under conditions which will tell us whether or not a vaccine is working. And the way that we do that is by making sure that the participants in the study are able to give us the information that we're looking for. So are they able to give us a strong idea about the immune response, among many things, the immune response to vaccines, so how the immune system in the body is responding to that vaccine. And so in an effort to do that in these studies and to find out if these vaccines will be effective for the general population, we specifically don't include people who have an immune system that would have a less robust response, because then if the vaccine doesn't work well, is it because the persons who participated, their immune system just wasn't going to work well? It just wasn't going to work well for them anyway? Or was it actually because the vaccine doesn't work well in regular, you know, in the regular general population? And so these studies, without specific sub-studies looking at how the vaccine works in immune compromised people specifically, did not include people like that. So to answer your question directly, we don't have specific information that says, like was said earlier, for pregnant women were not included, lactating women were not included. Same goes for immune compromised people who are actively getting immune compromising medications. They were also not included. However, again, looking back at how these vaccines are developed, I think the effect that we could expect is that the immune response that these people, immune compromised people, would provide to these vaccines is probably diminished. It's probably less than it would be for someone who's not taking those medications. But in terms of safety, I don't think that there is a reason for concern. I'm not aware of one. Again, because the way that the mRNA-based vaccines work, there wouldn't be a reason. And also for the way that the J&J vaccine, again, a virally vectored vaccine for an incompetent, what's called replication incompetent viral vector, that viral delivery mechanism or that delivery virus isn't going to replicate either in persons who are immune compromised. So, but again, are there specific data that address that situation? There are not.
I want to add.
Oh, go ahead.
No, I'm sorry, Courtney. I just want to add one other piece. Just that I just kind of took this up last night, just to get some numbers, and I think there's at least 64 other vaccines that are somewhere in human trials at the current time. So this is just the first 3. There's the AstraZeneca, which is out of the UK, which is also may or may not be available in the United States in the future, but that's probably the 4th one that's at least been approved. There's the vaccine that came out of Russia. I can't remember the name of that one right now. But there's a lot. And this is important because, again, we're obviously here in Maryland talking about our issues here, but this is a worldwide issue. We have 7 billion people to immunize over the next couple of years. And if we don't really look at this from a global perspective, we won't be able to really get our hands around this problem, even if we get a better handle on it here in the United States.
All right. I want to ask a tough question about vaccine choice and mistrust. And so in conversations with some folks, they've discussed, and some people are working at UMB, and some folks are working outside of UMB, but being somewhat leery of the Johnson & Johnson vaccine. Now, I'm not asking this question, but just a question that's come up with some folks, specifically with Johnson & Johnson's link to ovarian cancer in connection with their talcum powders and feeling like they cannot trust that particular company. Is there anything that you can add about the efficacy of that particular vaccine and the trustworthiness?
Can I just add on to that? Because we've got a number of questions here that people are asking. I keep hearing it's less than. I keep hearing that it's only 75%, and why should I want to get that? And so there were a lot of questions people have, obviously, just in our audience, let alone elsewhere, about is this really a good vaccine that we should get?
So that's a lot of questions, and I think I didn't keep track of all of them, but I think
we'll help you.
The one thing that I keep on telling everybody, and this starts with my own family, is the best vaccine is the vaccine that you can get. I mean, we're talking about limited access in some situations. And really, if you go to the vaccination center and that day they have J&J available and that isn't what you wanted, get it. That is what you got. That's what that's what's available. Waiting for another day to come in to try to see if you can get what you might perceive as lucky and be offered a different one is just it's not reasonable given the constraints that we're under for vaccine dosing and the urgency of getting vaccinated as soon as possible. So as much as we all like to, have a hierarchy for things, and this is nicer and this is less nice and this is really not nice at all, we really are not in a position to say that one vaccine should be favored over another for some perceived benefit or something, because again, the best vaccine is the one that you can get. But with that said, there may be differences between vaccines, but the fact of the matter is that even those differences are hard to interpret. So when you do, or when one does a study in a given population, and especially in this pandemic situation at a given time, and get certain results, you cannot compare those results just because they look like numbers and you think you can compare numbers. You cannot compare those results to another vaccine studied in a different population at a different time, especially in this pandemic that is so dynamic. So you can't, there's not comparing apples to apples. It looks like you are because again, they're numbers and math is math and one number is bigger than another number. But really the circumstances of those studies that took place in different locations at different times in the pandemic, you can't compare them. You just can't. And so to have this perception that that one is better than another is just, it's not a true comparison. But what I will say is that in all of these circumstances, one of the things and the messages that we've been trying to get out to the public is that, you know, these vaccines uniformly protect against hospitalization and death from COVID-19. And those are the most important outcomes that we're looking at, right? I mean, because we've had over 500,000 people die in the United States alone from COVID-19. And what we're saying is that these vaccines all protect you from dying. We've had so many hospital systems become overrun with people needing to be hospitalized. All of these vaccines protect you from going into the hospital. The other nuances that come on down the road, and again, have a lot to do with when and where the studies were done, I think is just really, it's just confusing to try to interpret at the same time, because again, you can't really compare the studies.
I wanted to add to that, Dr. Tapia, that a good vaccine, when we first started off, when they asked these companies to start making vaccines, we were looking for 50% effectiveness. And the fact that we got really lucky with the first two of getting 94, 95, whatever percent that they turned out to be was really astounding to everyone in the medical fields. 75% is still a very, very good vaccine. Most vaccines, our flu vaccines, don't usually get that much efficacy each year that we get that. So if that helps people put it in perspective for people, this is still a very good vaccine. And like Dr. Tapia already mentioned, we're really not so much looking at, we're really looking at as our endpoints as hospitalization and death. If we can prevent those two things, then we have a success. I think there were some other parts of that question, though. Can you help us out there?
Sorry.
I think some of it gets at that like systematic trust or mistrust, and so a lack of trust that individuals have in Johnson & Johnson in connection to the ovarian cancer that was potentially linked with their talcum powders over the years. And so this idea now that they are producing a vaccine and individuals not having choice in which vaccine they receive. And so having some apprehension around trusting Johnson & Johnson and then, adding that their efficacy rate was lower and all these other sort of questions and concerns, 1 dose versus 2 doses, all that sort of stuff, kind of adding to folks having some mistrust with that particular company.
I'd like to say, first of all, I think mistrust is healthy in most cases. As long as it doesn't go a little too far. There's a difference between some healthy mistrust and, conspiracy theory that, this virus came from aliens and they're really trying to take us all over and they're trying to inject us with nanoparticles that track us, whatever your kind of conspiracy theory is. There's lots of them out there. And again, I'm not sure if I can really speak to, I don't know that much about the company Johnson & Johnson. But in general, my take is that most pharmaceutical companies are all pretty much the same. I don't think there's anything special about Johnson & Johnson. I think this happens to be that this is one scenario where they, maybe did some things that were not appropriate. But I think if we looked hard enough at any of the companies, we would find some things that happens across the board. I don't think that has anything to do with the company itself. I could be wrong. Again, that's just based on my guess. I don't have any data to back that up. It's just a general feeling that I don't think Johnson & Johnson versus Pfizer versus AstraZeneca versus any other companies out there are that much different. I would like to say one other thing, and I guess this is kind of going to the area of talking about health equities, health inequities, particularly in minority populations, African-American populations, Latinx populations. This definitely is an issue that I think people have questions about, and we need to kind of be, again, adults about and discussing this. We have certain populations which have been historically and systematically marginalized in healthcare and in many other areas of life. And we need to be clear about the importance of making sure these populations get the vaccine. And that kind of leads to the question of the hesitancy. You know, why are we hesitant? Why are folks of Black and brown color hesitant to get the vaccine? If you look at the data and look at the things that have happened historically with medical care and through the years with Tuskegee experiment, they're probably being the biggest example. Henrietta Lacks, all current examples of just flat out criminal activity caused by healthcare and healthcare system that it does raise questions. So I do understand. I guess I'm trying to say I'm sensitive to, and I think if you weren't hesitant, if you weren't questioning, that's probably even worse than accepting things, because there's been a lot of history. Now, with that said, I don't think there's nothing that I've seen, and there's nothing that's been no evidence at all whatsoever that this vaccine has is not good for people of color. There's been something that's going to cause you to have any kind of downside effects, and that you should get the vaccine. So folks of color should get the vaccine. There's been no evidence whatsoever of any bad practice, ethical considerations that have been kind of not taken into account. In fact, we are in our university, and most universities are really trying to make sure that we get this out to our communities of color. So I want to just kind of start that conversation there too.
I think I would add too that since those events took place, there have been a lot of systematic changes to the way that research is conducted and in the way that it is monitored. And the FDA, as well as organizations like our very own University of Maryland, IRB, or Office of Human and Research Protections, Human Research Protections Office, HRPO, works to make sure that participants in scientific studies are safe and that the science is rigorous. I mean, these are all systems that have been developed and reinforced over the years to ensure that people who participate in studies are safe and that it is ethical research which is taking place. And then that the results on the scientific review side of the results from these studies are also interpreted in a way that is scientifically sound, and agencies such as the FDA have looked at the data coming from Johnson & Johnson and Pfizer and Moderna. And again, there are systems in place to ensure that the data show that these vaccines are safe. So I think although there were reasons to believe years ago that there were lack of regulation or lack of a checks system, if you will, there have been many checks that have been put in place now. Not that there isn't more progress to be made, certainly, but a lot of progress has been made already in that area as well.
So I think, Dr. Majette, you kind of opened this space potentially for folks if they wanted to share some of their experiences with access. I think that there has been a lot of conversation. Initially, there were conversations about specifically folks who are Black were hesitant. Now there's conversations that folks are actually asking for the vaccine, however, they're not able to access it. And so there have been folks who have talked about that specific to the Baltimore area, but also national as well. It might not be an area that you're able to provide insight on. And if it's not, that's okay. But I also wanted people to be able to share their experiences if they wanted to.
Yeah, no, that's great, Courtney. Let me just start by saying just the access piece. It is a nationwide problem. It's a worldwide problem. We're talking about access here. But if we just look at other countries that obviously that are less developed than the United States, they don't have any vaccine. We actually have some. So in the greater picture, it's just a supply problem. Excuse me. right now, and for the probably next 2 to 3 weeks, and maybe even a little bit longer than that, we are going to have less supply than we have demand for. We just don't have enough vaccine to give out, and not because we don't want to give it out. It's just not, the manufacturers just aren't able to keep up just yet. Now, Johnson & Johnson, I think, at least I last heard, sometime next week, Maryland should be receiving kind of its first kind of shipment. They thought it was going to be about a week or two ago, but then there were some manufacturing issues that came up. Not sure what those were, but we got a message that it's going to be about a 2-week delay. So it should be coming sometime next week. And at the same time, both Pfizer and Moderna have more shipments that are kind of coming out in the coming weeks to the states. It's not just Maryland. These vaccines are given out according to algorithms that the federal government and the states have all agreed upon. Here at Maryland, when we get our vaccine, what we've had given out so far, it's been, let me start by back up for a second. Our current vaccine effort at the hospital and then now at the SMC Campus Center has been through the hospital. The hospital and hospital staff are moving on to the convention center and the M&T Stadium to work with the state to give vaccines to their larger community in larger parts of Maryland. UNB is kind of taking over the vaccine effort at SMC Campus Center. Dr. Gerald has made commitments that that site will continue to remain open throughout the rest of the semester into the summer, and as long as we need to make sure that all of our people on campus are vaccinated when their time comes available, and that our population around our campus are vaccinated accordingly. We actually started talking to the Baltimore City Health Department, and starting next week, we will be getting some shipments from Baltimore that would typically go to Baltimore City directly to our campus, and they're giving us a list of their highly vulnerable people in our neighborhoods that we are going to vaccinate for the city to the folks, the list that they give us. Now, that's a limited list because we have limited vaccines, but we're going to use the same process. Once we get more vaccines, we'll spread that out, and people will be able to get more vaccines, I would say, shortly. My big, I guess, picture with this is if people can be patient, I think in the next few weeks, you will see an increase in access. I know that's hard for all of us to wait and be patient, but right now it's not because we don't want to give you vaccines. We don't want all of our 75-year-olds and 65-year-olds and people with comorbid conditions to get vaccinated. It's just that we don't have a vaccine to give you right now. And with that, I'm sorry, one last piece. When I talk to other colleagues in other places, other states, other places that are doing the same thing, it's the same story over and over again. So it's the vaccine, the supply is just not there. Sorry.
Well, and hopefully that disparity that I mentioned in the beginning of the program, that disparity, you see the numbers where you have, in a state with a population that's 30% Black, to have only 17% of those vaccines getting to Black residents, hopefully we'll be able to turn that around, because that is shocking for people. And they you have to wonder, why that's the case. It can't all just be hesitancy. So hopefully we'll be able to have an impact on that. Can I interject something here that really quickly, because a lot of people have asked, and we didn't say this up front. You two doctors, have you been vaccinated?
Yes.
Yes.
And what did you get? I'm just curious. Now they didn't ask, because I'm going to ask this. What did you get? Which vaccine do you know?
I got Moderna.
And I got Pfizer.
And you got Pfizer. Okay.
I think lucky enough because I was still seeing patients on campus and involved in doing a lot of the COVID care for our campus. I think I was on day 3 after the campus got their first shipment of Pfizer vaccine. So I was one of the very early folks on campus to be able to get the Pfizer vaccine, and obviously had my second shot early January.
Right. Well, for people who have gotten vaccinated, this is a very different sort of direction question. I want to get this out here, though, because I've seen a number of comments about this. So you have people who are being vaccinated and people who, for different reasons, some because they can't, they may have an allergy, for instance, they can't be vaccinated. Do you think that there's going to be, what about an immune passport? Is that moral or ethical? If somebody doesn't want to be vaccinated, is that going to affect how they move and access parts of society? Is it going to affect even people on campus where you may have people who, will they be excluded from participating fully? And that's a philosophical question. And as far as I know, you're not philosophers, but maybe you have thought about that.
Well, I can just say that I did put my vaccination card with my passport. I figured that that might be when I would need it if we're talking about passports. I think that I'm not sure. I think with these vaccines coming down the pike, as Dr. Majette mentioned, we have many vaccines that are still being developed, and I would hope that whatever constraints are keeping people from getting vaccinated with the presently available vaccines may be addressed by different ones that would come down later that might be more reassuring to people. I know, for example, that there were many people who were hesitant about getting these mRNA-based vaccines because it was a new technology. So maybe the Johnson & Johnson vaccine or another vaccine that comes down the pike might make them feel more comfortable being vaccinated. And so that hopefully having something, if it were to come to pass, that having something like a passport or something like that would be less exclusionary. Of course, the concern with anything like that is that the same people who are hesitant or have limited access would all be further marginalized by something like that, which would be really counterproductive. I don't know. Those are my incomplete, not totally fleshed out thoughts on the matter.
I think I would add to that, Alex, that the fact that we are human, and the fact that humans do things that humans do, like discriminate and make judgments or kind of make decisions based upon sometimes emotions and not based upon factual information. I think it really leads to I think at some point, if we're not doing it here, somewhere along the line, someone is going to use that information to include or exclude people in activities. It's just going to happen at some point. Whether it's good or bad, I guess, is a different question. And I can see how it can be used inappropriately because, like we've already said, we already have discrepancies in the vaccine uptake. And I do agree with you what you said before. If there's, it's all of it's not just because of hesitancy. There's just some access issues that we have to deal with. So it's something we'll have to kind of think about a little more deeply in the coming weeks and months, so that we can address it in a way that's appropriate and that does not marginalize people that just didn't have an opportunity to get the vaccine. Or, like you said, for whatever reason, their doctor said, no, I don't want you to get the vaccine. The benefit of the folks who either can't get it or decide not to get it is that if the concept of herd immunity, if we can get to a certain level of everyone else is vaccinated, then those people by default become protected because the vaccine can't be transmitted and replicated within the community, and then the vaccine eventually dies away. Now we're nowhere close to that. I think some of the experts are saying 75%, but somewhere probably between 70 to 80% is what we need as far as community immunization rates in order to kind of really get the benefits of herd immunity. Right now, I think the United States is probably right around 10% of people that are totally vaccinated at this point. So we have a long way to go. But I guess I'm kind of rambling now. I'll stop there.
This question may take us somewhere else as well. But, as we talk about those inequities with access to vaccines and thinking about the population within this state, and then the percentage of individuals who identify as Black who have actually been able to receive the vaccine, have you been in any conversations where there's been a discussion about prioritizing certain populations to address these inequities?
Yeah, I'm sorry, like I said, we have had some conversations on campus, and we've had conversations with Baltimore City Health Department, um, trying to make sure that we are actually getting at least initial vaccines to the folks that are at higher risk or in some of these higher risk categories. Including now, this part that we talked about was not so much looking at the racial inequities, but really just looking at who's around our campus. We think, and I think we think also that we have a responsibility as a campus university in downtown Baltimore, first of all, to take care of the folks that are, right across the street from us, that are in our kind of adjacent neighborhoods. We obviously aren't limited to that. So we've also had conversations that once we've kind of taken care of those folks, we will expand our access to vaccines, at least that we have access to the other communities. We have also had conversations making sure that we have things in place that allow people that don't have as much or as good internet access to sign up for these vaccines. So the state has a phone number that you can simply call, and they will actually walk you through the process or get you registered if you don't have internet access. Now we have to get that message out, which is the kind of the next difficult challenge for us, is getting a message out to the people who would need that message. Typically we give messages on things like this, on electronically. And if those folks don't have access to that, then of course they don't even know that we're doing our work. So we have a couple steps we have to fill in, but at least we've started having those conversations and we're moving in the right direction so that we can start going door to door, start giving out flyers, start going to the community places where people might go to shop for their groceries, and having that message out there so they can see it that, hey, I don't have to have internet or Facebook account or listen to this talk in order to find out, hey, I can go right 2 blocks down the street and get my vaccine at the University of Maryland.
All right. Well, we haven't heard from our audience in a while. Do we have anyone else who's interested in
We
sharing?
had so many people have wanted to be anonymous, so that's why I've been asking these questions. It's not me. I'd rather hear from them. And we are going to hear from Dawit Ayele. Dawit, are you there?
Department can start a case on it. Ultimately, what's going to
Dawit?
happen with that is those children are going to
I want to try one more time. Dawit Ayele, are you there?
Identity protection pins, which you'll have to use in order
she
to
must have
file
dropped.
your
See, I'm
test and
trying.
them on there.
But she asked if it's possible to develop
or
antibodies if you're tested positive and
Probably
recovered.
an easier way to do it would be
So in other words, maybe you weren't sick, you didn't feel sick, you didn't have symptoms, but you tested positive at some point. Is it possible that you could have developed some immunity?
Sorry, there was a little bit of an interruption in your question. There was a voice that was interfering. So can you repeat that? That was distracting.
She's asking if you've tested positive. I mean, you may or may not have developed severe symptoms, but you tested positive. Do you need to get vaccinated? I mean, maybe you already have immunity. What's the reality there?
The reality is that that the recommendation is to get vaccinated irrespective of whether or not you've had symptomatic, asymptomatic COVID-19, whatever it is. Everybody needs to get vaccinated.
The one caveat to that people may have kind of heard about or at least partially read about is that we are in some ways asking that people wait 90 days from the time of their COVID illness before they get the vaccine, not because it could harm their health, but because we think that you do have some immunity for those 90 days, and we'd like to get the vaccine into people who don't have any immunity first. I think, again, that should go away. That problem should not be a problem once we get more vaccine, but with our limited supply, we're kind of asking. But if you show up and you want a vaccine and it's just been 3 weeks since you had COVID, we're not going to turn you away. We're just asking that maybe give someone else a chance to get immunized and have some protection, since at least it looks like you will have some natural protection because you had the illness.
All right, I'm sorry to say Deborah Blainer dropped off, but I think her question is very important because people, and I think it's reflected in some of the questions you received. She asks, what about the possibility of the vaccine causing other problems in the future, like cancer or organ problems. Does this vaccine totally work itself out of a person's system, or do I have to worry about this down the road?
The science tells us that the vaccine works itself out of this, as you put it, I think it works itself out of the system. At this point, there's no reason to believe that the mRNA vaccines, that the mRNA lingers any longer, or for the J&J vaccine, that the viral vector that's used to introduce the DNA for the spike protein lingers around either. So again, there's no reason to believe that there would be long-term effects that we wouldn't otherwise anticipate. But admittedly, these vaccines haven't been used for a very long time. So. You're muted.
You're muted.
You know, you're bound to do that at least once in every show, I think. I'm sorry about that. But I do want to give you an audience member who has a question, an important question. Valerie Barksdale, are you there? Oh, Valerie, you're breaking my heart. Well, she has a question about her mother.
I'm here.
I guess we can. Oh, go ahead. I'm glad you're there. I want you to get your answer.
Yes, thank you. And actually, Dr. Tapia has touched on it a little bit already, so I think I'm getting a clearer answer. But we came across, my brother works in a hospital, and he sent us an article from Natural News, and in it, it was speaking about the mRNA technology that you did reference, and that scientists have found that it inactivates tumor suppressing proteins, and which can cause cancer long term. And you were just saying that there's no reason to believe that it would be harmful down the road because it kind of removes itself from the body. Is there any truth to this article that the mRNA technology can do what they're saying it can do, causing cancer, because of what it does to these tumors and activating these tumors? Does that make any sense?
Yeah,
I'm asking because we do have an 81-year-old mother, and my sister had also had breast cancer, and we just wanted to, if it causes cancer later on, we just want to make sure that we know whether they should be taking it or not. Thank you.
Sure. So the short answer is that not all mRNA is created equal. That's the short answer. But the long answer is, so I think you sent in your question beforehand. And so I did have the opportunity to look up, because I wanted to, I think one of the challenges of sort of misinformation that's on the internet is that and that people report back to, me or to Dr. Majed or anyone else who's talking about vaccines, is that we don't always know the source of where did that come from? Why does somebody think that, pink crayons cause cancer? Like, what is that? Where did that come from? And so again, thank you for sending your question in early, because I did have the opportunity to find, if you will, where that came from. And so the issue is that mRNA is just a word. It's like mRNA. It doesn't mean the mRNA that codes for the spike protein is not mRNA that causes cancer, is not mRNA that makes my eyes brown. It's not mRNA that causes somebody else to be tall. So mRNA is just a word. It's like pants. All pants are different. Some pants are short pants, some pants are long pants. So it's like somebody saying to you, pants cause cancer. Like, what kind of pants? What do these pants look like? What do they do? So just because the words are the same, mRNA and mRNA, doesn't mean that they're actually the same thing. So the mRNA that's used in the vaccines, again, is mRNA that codes for a part of the spike protein, which are the little points that poke out of the virus that we've seen in all of the cartoons that has these little things that poke out, these little spikes. And that is what that codes. The mRNA that was being talked about by our colleagues at Memorial Sloan Kettering in New York is mRNA that has been found that codes for proteins that actually make it possible for people to have cancer. That's true about lots of cancers, actually. It's just that there was this one reference that came out, this one article that came out that said use the words, or the letters really, mRNA, and everybody said, oh my gosh, mRNA, that's a bad mRNA. No, these are two completely different things. And there is no reason to believe that they are at all related, and that the mRNA that codes for the spike protein, again, that's used in the vaccine is similar. There's no reason to believe that it's similar at all to the mRNA that codes for proteins that act in cancer genesis in people.
And that's one of the things that kind of upsets me about sometimes of our media. And I understand why they have to do it, because they want to sell papers. But I think the folks that were putting that article out knew that putting mRNA in that article would gather people's attention and it would get more people looking at that article. But it's a little bit deceptive, just like Dr. Tapia said. It's just not the same thing. So I'll stop there because that's my little soapbox on media sometimes.
So, I think we don't have that much time left. So I wanted to ask some questions about where do we go from here? So with that last question and what information do we trust, do you have suggestions on how folks can go about finding helpful and accurate information? And then also, do you have suggestions for individuals and organizations for addressing systemic medical mistrust and just mistrust in general?
I think your first stop is your doctor. I mean, that is the main, that person, and hopefully people have doctors that they can trust and bring their questions to. But really, that person should be the person to whom any scientific, medically related doubt goes to. Because, I think that I would say, and also there are many websites like the FDA website, the CDC website. Those are reliable sources of information, but they can be difficult to digest. And when people don't understand what they're reading, they tend to say, oh, they're probably saying something that I don't understand for a reason because there's something hidden in there. Someone could think that. And so that's why, again, you should go to your doctor and say, what does this mean? Because I read that, but I didn't understand it. So I thought maybe there was something I missed. So I think really their first resource should be your doctor.
I want to give a shout out to one of my favorite patient-centered websites is through the Mayo Clinic. They do a fabulous job of vetting all of their information that they put out, and it is written in a way that's easy to understand. Now, it's not going to go into details, so it's not going to, talk about the details of that, but it's a good starting place, I would say, to go to, and it's a public website, Mayo Clinic. I think it's mayoclinic.org or .gov, or I'm sorry, not .gov, .com. But you can find it easy to find. Obviously, we have at our own university, we have our own website. You guys can go onto the website and kind of try to find good information there. I think one of the things that's, and we've kind of talked about this from a campus standpoint, we're realizing that a year into this pandemic, everyone has put out a lot of information on COVID. And at this point, all the information is just kind of out there, and kind of like your junk drawer in your home. It's hard to find anything that you want to find. Where's that pair of scissors down in there? So we are going to make some efforts over the next couple of weeks to months to kind of sort through that and maybe have up front kind of the top things we want people to kind of know and understand, whether it's about campus and COVID, whether it's about our vaccines and COVID, just that type of thing. So I think hopefully other folks are going to do that same thing. Up till now, we just haven't had the bandwidth. Everyone's been running and trying to stay up to speed on all of this, all the changes that come about. The CDC just came out with another, like I said, 2 days ago with this new update. And it's hard to keep up with all of that and to update all the websites and all the information that we have. But we're going to try to make some efforts to do that. So hopefully information will be more easily accessible, at least the information that you really want to read about. I would say the other thing with strategy wise is continue to do everything that we've been doing. Get the vaccine when it's offered, do all of the transmission precautions that you've been doing with distancing and washing hands and wearing your mask. I'm sorry, let me give one little kind of caveat. I just thought about this the other day. There was a time when seatbelts were not required. When I was little, we just all piled in the back of a station wagon and, there were no seatbelts. Now you almost don't even think about it. If you get in the car without your seatbelt, it's just what you do because it helps you, it keeps you safe and your family safe. The same thing should be with masks. It shouldn't be that we are arguing about not wearing a mask. It just makes sense and it doesn't cost anything and it doesn't cause any problems. So I think hopefully with some more time, we can get to the point where they're talking about with masks as with seatbelts. Anyway, I'll stop there, get off my soapbox. Those are the things I would suggest that we do going forward as far as strategies to keep ourselves and our family safe. And we will hopefully do some of these kind of updates in the future. Once we get more information, we'll be glad to come back and give you guys updates on what we know.
Well, thank you for that. I want to thank our panelists, Dr. Majette, Dr. Tapia. Thank you for being so approachable, for being relatable, for providing examples that are accessible to many individuals. So thank you for that. I also want to thank Alex for managing and hosting this event. You do a wonderful job, and I cannot thank you enough. To all of our participants who provided questions, I know we weren't able to answer all of them, but I want to thank you for taking that time, and hopefully we'll be able to share those questions and think about ways that we can get those answers to you. So again, thank you for everyone who is in this space today. We appreciate it. And I hope that you continue to have conversations with healthcare professionals who can provide you with the information that you need, validate your experiences, but also share factual information that will help you to make informed decisions. Thank you so much, everyone. I hope you have a good day.
All right. Take care.
Thanks, everyone.
Thank
Bye.
you.
Thank you. Thanks for having me. Bye.
Thank you.